Welcome to Eurofins Viracor Clinical Diagnostics Podcast, where I'll be sharing up-to-date scientific advances, key diagnostic testing, and our most recent innovations. Today is January 12th, 2021. In this episode, I'll be discussing a challenge that many immunocompromised patients face during the COVID-19 pandemic, and how our mobile phlebotomy service, Labs at Home, can help your at-risk patients get the continued testing they need. Consider a first-time transplant patient just prior to the start of the COVID-19 pandemic. Any kidney transplant presents challenges, but an immunocompromised post-transplant patient during a global pandemic comes with additional difficulties. As the hospital system became increasingly stressed with COVID-19 patients, bone marrow transplant and solid organ transplant patients may be unable to return to the hospital for routine and specialized post-transplant testing and management. These immunosuppressed and immunocompromised patients are already at risk for transplant rejection due to infection or graft failure and subsequently fall into a high-risk category for COVID-19. Given CDC recommendations indicate immunocompromised patients should stay home as much as possible, socially distance, wear masks, and set up delivery of food, medicine, and supplies if possible. It was important for Viracor to help find a viable solution to help patients receive necessary routine post-transplant care. Utilization of grocery and prescription delivery helped those patients stay socially distant. Why should routine laboratory testing be any different? Labs at Home and at-home mobile phlebotomy service was launched in March of 2020 to help patients stay out of busy waiting rooms and provide necessary service to help support their physicians as they make post-transplant treatment decisions. Labs at Home enables physicians to order from a select menu of infectious disease, transplant-related, and routine blood testing for these at-risk patients. A professional phlebotomist schedules the time to safely perform the specimen collection directly from the patient's home. Our phlebotomists undergo a background check and are regularly screened for COVID-19 to minimize the risk to the patient. You can watch the video in the podcast summary to learn even more about Labs at Home. With testing tailored for BMT or SOT patients, ordering options include key PCR tests like adenovirus, BKV, CMV, EBV, and HHV6. Therapeutic drug monitoring for immunosuppressive and antifungal medications, CMV T-cell immunity panel, Viracor Track, transplant rejection allograft check, as well as TrueGraph blood gene expression test, powered by Transplant Genomics Eurofins. The results of these tests can aid providers in making critical treatment decisions with the hope of more successful outcomes. By providing this specialty service for the transplant community, Labs at Home enables Eurofins Viracor to help these critical patients in an integral time post-transplant in the wake of a rapidly changing healthcare situation. Ordering is easy. Call 1-800-305-5198 or email info@eurofins-viracor.com. Visit the links within this podcast summary for quick and easy access. Make sure to subscribe to this podcast and follow us on social media to stay up to date on all the latest information. If you want to help spread the word, please give us a 5-star review and tell your friends and colleagues to subscribe too. We're available on Apple Podcasts, Spotify, Google, Podbean, and more. With over 30 years of specialized expertise in infectious disease, immunology, and allergy testing for immunocompromised and critical patients, Eurofins Viracor is committed to helping medical professionals, transplant teams, and reference labs get results faster when it matters most. Viracor is passionate about delivering value to our clients by providing timely, actionable information, never losing sight of the connection between the testing we perform and the patients you serve.